Hello, and welcome to Movement with Purpose. I'm Evelyn.
And I'm Alvin.
And we'll be sharing a story and utilizing the RIPS model to analyze and address an ethical issue. The case we'll be looking at involves Diane, who is a PT, and her interaction with her new patient, Frank, who is a 54-year-old male with MS. Her first encounter with Frank was him being upset and accusing her that she took a long time to take him in, even though he arrived early and she took him on time. She calmly responds, and they continue with the evaluation even though Frank does not seem happy. As he's performing tasks, Frank experiences discomfort and shouts at Diane using vulgar language, loud enough that it can be heard several rooms away. Taken aback, Diane informs him that he needs to share how he is feeling so she can make the proper adjustments to decrease his discomfort, and mentions that the vulgar language is not okay. However, Frank responds with a smile and tells her he is just messing with her. This is a type of language he is accustomed to due to his military background, and tells her to relax and that she's a little uptight. She informs him that she respects the military, but she does not condone inappropriate language and specifies that others should not have to hear it as well. Frank responds that it is his right to say what he wants and tells her to just worry about the job and to not hurt him anymore. As the session continues, no other issues are present between them, but he continues with inappropriate comments and states he is simply just messing around. Once he leaves, Diane comes up with a solution, which is to reassign him to a nearby hospital with a no-nonsense colleague who is an ex-Marine. She presents her idea to her immediate supervisor, who then mentions it to her big boss. However, she denies Diane's plan and says if they go through with it, it will be considered abandonment. This leads to Diane's disappointment and surprise.
As we analyze the case, we will use the RIPS model, which focuses on the individual process and the situation itself. This case falls under the individual realm because it deals with the interpersonal behaviors between Diane and Frank. The ethical issue arose from the direct interaction, which focused on individual behaviors and values. The individual process is the ethical decision-making process that goes through when coming face-to-face with an ethical dilemma. The four components of it are moral sensitivity, moral judgment, moral motivation, and moral courage. The components help the individual identify the ethical problem, decide what the right course of action is, and take it despite any potential challenges. This is a distress situation since she came up with a solution, but her boss does not allow it due to it being her patient.
Looking at a different perspective on this issue, I would agree with Diane that the vulgar language is not appropriate and should not be tolerated. But I feel that a possible explanation for Frank's behavior is that he feels uncomfortable in the situation, and this is his way of coping and feeling comfortable in this new therapy setting. What do you think?
I'm gonna have to agree with you, Evelyn. I see how Frank's military background could have been the reason for him to use rough language as a pseudo-coping mechanism. However, Diana has a responsibility as a healthcare provider to maintain professionalism with both her colleagues and patients. I do believe Frank's behavior needs to be addressed in a way that is both strong and empathetic.
If you would consider a potential solution, I would advise giving him another chance and being open with him about how she feels, since she already informed him that it made her feel uncomfortable, and say the behavior hasn't changed, then a different course of action should occur. I believe she should talk to her boss again, with or without Frank, or get the approval to talk to Frank about transfer of care. I feel that would benefit him because working with some patients, I have noticed that individuals who experience similar situations, such as the military, tend to react in a different manner, typically more favorable. What is a solution you would advise?
I see it as important to approach the situation with transparency. I'd recommend that Diane and Frank have an honest conversation about her boundaries and expectations. However, if the behavior doesn't change, there should definitely be a different solution. That being with the involvement of her supervisor and potentially HR, ensuring she feels supported professionally.
Now let's recap. Diane is put in a situation where she has a patient who makes her feel uncomfortable since he makes inappropriate comments and uses vulgar language. However, when she comes up with a solution, it was denied.
Diane is motivated by the need to hold a respectful and professional environment. Frank's history and background complicate the situation with a need for empathetic and clear communication for a common resolution. The ethical dilemma is created with tension between the patient, autonomy, and professionalism. This case brings to light the complexities of maintaining boundaries in a professional setting while having empathy in scenarios. This challenges us to think about how we need to address behavior that isn't appropriate in a way that protects the professional's comfort and the patient's dignity.
Lastly, we'll ask our listeners, what would you do in Diane's situation? Would you approach this situation differently? In what ways would you balance empathy with professional boundaries?